Whether or not to get an MRI or an X-ray is a really hot topic for those people who've been experiencing back pain. What I'm going to do today is give you a roundup of all of the information that you need before you decide whether or not to have one. Firstly, as a practitioner, if I want to take an X-ray or an MRI of a patient's spine, I need something called clinical justification. If I have clinical justification, that means I'm expecting to find something on that X-ray or on that MRI that is going to change how I manage that patient's back pain. Now that could be anything from a fracture to a structural change within the spine, like a spondylolisthesis. You also need to familiarise yourself with the types of back pain. So only around 5% of back pain is due to any kind of structural change within the spine, like I mentioned before, like a fracture or a spondylolisthesis. Less than 5% is due to anything what we call pathological, like an infection. Around 90% of all back pain cases are what we call multifactorial. This means that they're made up of multiple smaller factors that are embedded within your lifestyle. This type of back pain is what 9 out of 10 people have, and this cannot be seen on an X-ray or on an MRI. You know, it's impossible to see whether someone has poor quality sleep or high stress levels, or they're just not exercising enough on their X-ray or on that MRI. When most people have an X-ray or an MRI, it will show up with some sort of wear or tear, spondylitis, spondylosis, or osteoarthritis. One of those words is often used. And this is actually a really common thing. We actually know that you can find this in people's spines even from like around their 20s upwards. These things are governed by our genetics and are only very loosely related to our back pain. So when we see X-rays or MRIs of our patients who have this in their spines, we're not usually worried because we know that the person in front of us can still recover from their back pain. The most common pitfall with X-rays or MRIs is we spend far too much time focusing on what is on them, and this affects your ability to recover. Back pain levels are now accepted as being partly due to the medical profession. What that means is so many practitioners just do way too many tests to try and figure out what is causing somebody's pain. But the thing is, for 90% of back pain being multifactorial, you can't pick up that on all of these specific medical tests. Only by sitting down and talking to and listening to a patient can you actually figure out why they're experiencing the pain that they have. So if X-ray and MRI findings are only very loosely related to the pain you're feeling for 90% of people with back pain, perhaps we should spend a little bit less time worrying about what's on them and a little bit more time thinking about what we're going to do going forwards. What is far more important is that we start to talk about the things that you can implement that are going to better help you recover from your back pain. And this is where the 3 M's comes in. Mindset makes sure that we tackle any faulty beliefs, we teach you how to get the right kind of sleep, and we show you the ways that you do and do not use exercise for back pain. Mindset and mindfulness are where we get to it with practical tasks that allow us to regain control over our bodies and over our pain. What I'm trying to say is it's better to use your time and your energy to focus on looking forwards about what you're going to do to move away from where you're at, rather than overanalyzing where you're at right now. Focus on your mindset, your movement and your mindfulness, and you'll end up where you want to be. Wait, don't go just yet. If you found that content useful, then make sure you head over and join our brand new Facebook community, Low Back Pain Recovery. And you can even feel free to add me personally on Facebook. Also, make sure you like this video and subscribe to our YouTube channel, The Movement Studio Programs. That's all from me. Again, my name's Rob Bailey from The Movement Studio and the Spinal Recovery Program. Enjoy the rest of your day.